Chronic kidney disease. You guys already heard this, and I will just cover this again because it is necessary that we go through these guidelines. Stages of chronic kidney disease. The ICD-10-CM classifies CKD based on severity. The severity of CKD is designated by stages 1 to 5, okay? Stage 2, code N18.2, equates to mild CKD. The stage 3, N1830 to N1832, equate to moderate CKD. And stage 4 equates to severe CKD. Code N18.6, end-stage renal disease, is assigned when the provider has documented end-stage renal disease. If both stage of CKD, if both a stage of CKD and ESRD are documented, assign code N18.6 only. Okay, so let me go to the board, guys, and show you how do you determine the stage of CKD. We had this discussion before. So the stage 1 right here is almost negligible. I think the thing, guys, is as we age further, our the renal function also ages, and the kidney function kind of like gets affected as as the person ages. Now the stage 1 CKD is almost negligible in the sense that the kidney function almost is basically still working working all right. Now when you get to stage 2, the primary test for the doctor to be able to determine that is what we call the creatinine and GFR. The creatinine level or the GFR level. Okay, that's how the doctor determines. So the higher the creatinine value, creatinine, guys, this is the waste product that is circulating in our blood. Okay, our kidneys function is to filter those waste products and purge them out, when we go do number 1, when we go pee, right? So that's the creatinine is the waste product that is retained in the blood system and circulating in our blood if the kidney is not filtering to its best capacity. That's the reason why if the creatinine level goes up, then that means to say the kidney is not working the way it should work. Now for stage 1 CKD1, the creatinine level almost is normal level. For stage 2, the creatinine level will show a little bit of elevation of that value. So the GFR now in the GFR, by the way, stands for glomerular filtration rate. The GFR is the measure how the kidney is filtering. So the lower the number, like this one right here for CKD1, I'm trying to explain to you guys the clinical the disease process, how doctors would make their decision whether patient has this acuity or the severity of the CKD. Now for stage 1, from what I understand is the GFR is from 90 and above. Now the stage 2, you can Google it up, guys. The GFR is somewhere 70. This is 70. I think 61 to 89. Okay, this is your mild CKD. Now correct me if I'm wrong. Like I said, guys, You can Google it up what the GFR value for these stages. Stage 3 is from 30, this is moderate. Your GFR is from 31 to 59. Stage 4, which is your severe CKD, is from, this is the stage, from 20, was that 20? Oh, no. It's from 16 to 29. 29. The 30 to 59, 16 to 29. And stage 5 is from almost 6, 15. This one is ESRD, filtration rate is 0. So this is what the doctor looks, guys, to determine the severity of CKD. I want you to focus, I want you to pay attention to the severity as it is, explained in these categories here. Mild, moderate, severe. There was a question in the AHIMA exam asking what is, if the doctor says severe CKD, what stage is that? If the doctor says it is mild CKD, what stage is that? So just remember that. That's why I want you to pay attention here and make sure to remember that stage 2 is mild, stage 3 is moderate, stage 4 is severe. And the stage 6 is ESRD or end-stage renal disease. ESRD is end-stage renal disease. This one here, sometimes called, doctors sometimes call it advanced, okay? Advanced CKD. But this is, the stage 5 is rarely labeled because stage 5 is almost stage 6. If the patient reaches stage 5, doctor will now order for patient to get evaluated for dialysis treatment. So if the patient goes to dialysis, your stage 5 automatically becomes stage 6. That's why stage 5 is rarely diagnosed, rarely labeled, because like I said, when a patient reaches stage 5, doctor will now order for renal dialysis. Okay. Now the creatinine level goes by, there is actually a measurement according to gender. For female, let's say creatinine here, okay? For female, the creatinine is 1.1 or 1.10. This is the threshold. Guys would be 1.30. This is female. This is male. So what this means, guys, is that the creatinine level in the blood, the threshold for female is up to 1.10. I forgot what kind of measurement that is, but this is how it is reflected in the laboratory report. For guys, you have 1.30 as your threshold. Anything that goes up there is considered as abnormal level. So if this goes up, that means to say the kidney function is also deteriorating. That's what this creatinine level does. Sometimes if the creatinine level goes up abruptly without, if a patient does not have any kidney disease, that means to say at some point the kidney is overtaxed, okay, is overworked, or patient might have been experienced some degree of dehydration, the kidney suffers. And when the kidney suffers because of like dehydration or infection, the creatinine level, guys, goes up. If the creatinine level goes up more than 300% of the value, that's what we call acute kidney injury, okay, AKI. So AKI, guys, acute kidney injury, have different categories like pre-renal, intra-renal. So, later on, guys, you will, as you continue to work as coders, you will be able to understand better what these conditions are. Okay, so this is the disease process. This is how doctors determine or make their decision as to how bad the kidney is working, or how bad the kidney is, the severity is for that patient. Okay, now as what is written here in the guidelines, guys, let me see here. Let me go to the presentation here. So like I said, I have read this earlier, the ICD-10-CM, okay, classifies CKD based on severity, and you guys have seen that. Now, the codes for CKD, of course, you guys already know this. The category code starts with N18, N18 right here. Okay, and the last character will be dependent on what stage the CKD is. For unspecified CKD, what is the code? N18.9. But for CKD where the stage is specified, like stage 1, your code would be N18.1. For stage 2, N18.2. Stage 3, N18.30 to N18.32. Because stage 3, guys, has two classifications, whether it is stage 3A or stage 3B. So depending on that type of stages, you are to assign this code range right here, N1830 to N1832. And it's an easy, navigation in your book because it's a straight coding. Okay, let's go to the next one here. Now let's go to a patient who has experienced severe CKD, or not severe CKD, I mean like ESRD, end-stage renal disease, and patient eventually had transplant. So let's read here. Patients who have undergone kidney transplant may still have some form of chronic kidney disease because the kidney transplant may not fully restore kidney function. Therefore, the presence of CKD alone does not constitute a transplant complication. Assign the appropriate N18 code for the patient's stage of CKD and code Z940, kidney transplant status. If a transplant complication such as failure or rejection or other transplant complication is documented, then assign the complication code. Okay? If the documentation is unclear as to whether patient has complication of the transplant, query the provider. What the guidelines are saying here, guys, is that we had this discussion last night that a patient who had kidney transplant does not necessarily provide or give the patient's fully functioned kidney, because the transplant procedure does not, completely fix the kidney, the kidney problem. So that's what the guidelines are trying to say here. So if the doctor documents patient has still some form of CKD after transplant, do not assume that this is a complication. You still have to code the chronic kidney disease, even if patient had already had a kidney transplant. But because what the guidelines are saying here, it may not, the kidney may not fully functioning, okay, after the transplant. It takes a little bit of getting used to, because of course they need to see if the transplanted organ is received well by the body, by the host. And in that case, guys, the CKD, whatever stage that is highly, highly possible. So this was the question from last night, one of those scenarios that we answered. And what else? Chronic kidney disease with other conditions. We already know this, guys, but let me read this. Patients with CKD may also suffer from other serious conditions, mostly Most commonly, diabetes, mellitus, and hypertension. The sequencing of the CKD code in relationship to codes for other contributing conditions is based on the conventions in the tabular list. We already know the combination code, right, for each condition that is mixed or that is combined with CKD. And when we were trying to learn the sequencing, guys, of CKD and other conditions that were mentioned here, like diabetes and hypertension, we already know that the hypertension and diabetes take priority in the sequencing. We already know that, right? So if a patient has, just to give you, just to remind you again of what we have already learned from the past about CKD and also, about diabetes and hypertension. Make sure if a patient has diabetes and CKD, assign the combination code for diabetes, which is E1122, followed by your CKD code. Because the tabular, which was mentioned in the guideline, will give you that instruction saying that after you have assigned the code for diabetes, you need to assign the code for CKD in order to determine what stage of CKD that is. The same way with hypertension. Hypertension code always takes priority over CKD, but do not forget the follow-up instruction saying assign or use additional code to identify the stage of CKD. In that sense, guys, you are to assign CKD code as secondary diagnosis.